5.
Good afternoon. Welcome everyone to today's unveiling of CADTH's 2023 watch list of the precision medicine trends likely to shape the future of healthcare in Canada. We have quite a crowd here in our Ottawa office and over 1,000 of you on the phone, so really excited for today's event. My name is CADTH Huddy. I am the Executive Vice President of Evidence Products and Services here at CADTH, and I will be the moderator for today's event. As we give a minute for folks to arrive, I'll just go over a few housekeeping items. Today's presentation will be recorded and posted on CADTH's YouTube channel later on this week. The report can now be found on our website. We will provide a link in the chat as well, and we will also send out an email to all registrants after this event with a link to the report. After I introduce the 2023 watch list, we're going to head into an engaging discussion with our expert panelists. We'll have some time for several questions from the audience, so please ask your question by clicking on the question icon. Now, before we begin, I'd like to acknowledge that I'm speaking to you from CADTH's Ottawa office, which is on the unceded territory of the Anishinaabe Algonquin Nation. We honor all First Nations, Inuit, and Métis people and their valuable past and present contributions to this land. For those of you who may not be familiar with CADTH, CADTH is a not-for-profit organization responsible for providing Canada's healthcare decision makers with objective evidence to help make informed decisions about drugs and other healthcare technologies. We're funded in part by the federal, provincial, and territorial ministries of health, with the exception of Quebec. We also receive application fees from the pharmaceutical industry for 2 of our programs. Before I provide an overview of this year's watch list, I want to introduce everyone. I've already introduced myself. My name is CADTH Huddy, and I will be the moderator, and this is my disclosure slide. Our first panelist is Dr. Shantanu Banerjee. He is a medical oncologist with a practice focused on lung cancer and sarcoma at Cancer Care Manitoba, where he is also Director of Precision Oncology and Advanced Therapeutics. His laboratory at the Cancer Care Manitoba Research Institute is focused on the application of comprehensive genomic profiling to guide cancer discovery and treatment. Our next 2 panelists are Karen Dewar. Karen oversees Genome Canada's large-scale genomics program and Genomics Applications Partnership Program. She is regularly involved in discussions with our partners about programs, guidelines, and policies, scientific evaluation, and peer review processes. And last but not least, our final panelist, Valerie McDonald, is a former social worker who now works as a freelance writer and editor for health and social service organizations. She's a longtime patient advocate and currently serves on several working groups with a focus on palliative care and pediatric cancer care. And for 6 years, she was a member of a CADTH committee representing a patient's perspective during deliberations about new cancer medications, including some precision medicines. She was also an advisor for our 2023 watch list. In the spring of 2022, CADTH released our 2022 to 2025 strategic plan, which is designed to advance evidence-informed healthcare and reinforce our role as the hub for health technology assessment in Canada. In alignment with our new strategic plan, and specifically our Anticipate pillar, CADTH is more focused than ever on supporting system readiness and meeting decision-maker needs by providing future-focused evidence. In 2022, we introduced our first watch list of health technology trends to watch. This report was so well received that we decided to make it an annual event. Our watch list is meant to give an early signal to health system leaders about what's coming next regarding emerging technologies and provide some context for some of the decisions that may lie ahead. So to briefly recap the 2022 watch list, it featured 10 technologies that spanned a wide range of clinical areas and were identified to be disruptive to healthcare systems in the next 2 years. For example, AI, point-of-care testing, remote diagnostics, etc. This list also included molecular and genomic testing technologies, and that is now a nice segue to our 2023 list. So while the previous watch list highlighted the top 10 technologies that spanned a wide range of clinical areas, This year's list focuses on the single theme of precision medicine. Precision medicine is an approach that uses information about an individual's unique biological, environmental, and health behavioral characteristics to inform and tailor their care. That's why it's also referred to as personalized medicine. Precision medicine shifts the focus from the population to the individual, meaning that care can be tailored to a person's genetic makeup and their individual characteristics. The selection of this theme builds on our past work and takes into account the pace at which innovation is occurring in this space and the need to equip policymakers with forward-looking information. And so now our watch list. The 2023 list signals 5 precision medicine technologies that may have the most significant impact over the next 5 years. The report also examines 5 cross-cutting issues related to policy, social, and legal aspects that affect the broader scope of precision medicine technologies and their ongoing development, adoption, or implementation in Canada. This report helps to separate some of the hype from the hope about the prospect of these technologies to guide health system planning. In terms of how we generated this list, to be considered for the list, the technologies had to be new or emerging, so not yet widely available or adopted in Canada. The issues under consideration had to be ones that would significantly impact the broader scope of precision medicine. CADTH developed the list using a modified James Lind Alliance priority setting approach. This approach enables researchers, clinicians, patients, and carers to work together on equal footing to arrive at research priorities. A short list of emerging technologies and issues was identified from published literature and industry news with input from an expert advisory group. The final items were then selected by a panel through a consensus-based decision-making process. The panel brought together diverse views and experiences, including patient partners, people with lived experience, policy and legal experts, researchers, industry representatives, and healthcare professionals from across Canada. So in terms of our top 5 technologies, I'm now going to cover them briefly, the 5 technologies and the 5 cross-cutting issues. I do want to leave much of the floor open for our expert panelists who can really discuss in more detail the value and the disruption or complexity that these technologies could bring to our health system. So trend number 1, digital tools to access genetic information and navigate care. According to a recent survey that was just published last week by Canada Health Infoway, Canadians are accessing digital health services like never before and report that it's making a huge difference in their health. Digital tools like patient portals and other applications give clinicians, patients, and their families direct access to individualized health information. In the context of precision medicine, these technologies can help people connect with their genetic test results, make sense of complex findings, and provide them with opportunities for meaningful engagement with healthcare professionals to discuss results. Trend number 2, liquid biopsy for informing cancer treatment. Liquid biopsy is an emerging technology that detects genomic information, DNA or RNA, in bodily fluids. While traditional approaches rely on surgical biopsies, liquid biopsies could shift existing approaches towards less invasive testing technologies. Although different types of liquid-based biopsy tests exist, CADTH looks specifically at those to guide treatment decisions after a cancer diagnosis. As an example, liquid biopsy can provide information about how one might respond to different drug therapies, such as the potential for drug resistance. This information can then be used to more precisely guide treatment decisions to maximize benefits and reduce potential harms. Trend number 3, omics-based sequencing technologies across pathways of care. Whole genome, exome, and transcriptome sequencing are precision medicine technologies that are collectively referred to as omics-based technologies because they characterize the entire genetic makeup of an individual's cells and tissues. Because these tests are so comprehensive, a single test can be done as soon as clinical symptoms present, rather than a series of individual tests assessing limited amounts of genetic information. This helps to improve diagnostic information and possibly increase the speed of diagnosis. Although genetic sequencing has been used extensively in research settings, in the next 5 years, these technologies may see greater implementation into routine care due to their potential for providing more precise and a wider span of information. Their adoption across the continuum of care from diagnosis to classification to treatment could drastically change healthcare in Canada. Trend number 4, pharmacogenomics tests for mental health conditions. The promotion of mental health has never been more of a priority. Although drug therapies are only part of the treatment approach for those with mental health conditions, finding a drug that is both effective and without side effects can be a drawn-out endeavor of trial and error. Pharmacogenomics tests characterize genes to predict how individuals may respond to different drug therapies. They offer the advantage of helping to guide a more tailored and objective approach for selecting treatments while keeping the patient's experience in mind. Unlike some clinical areas such as oncology, there has been relatively less development of precision medicine technologies in the field of mental health care. However, there is a growing prospect that these technologies could lead to significant change over the next 5 years in terms of how drug-based therapies are prescribed for mental health conditions. Trend number 5, population-based genetic screening interventions. Screening aims to detect the early signs or assess the likelihood of having specific health conditions among people who are otherwise asymptomatic. At the moment, many screening interventions include genetic screening, are limited to specific subpopulations, which could miss a substantial portion of people who may have high-risk mutations. It's possible that over the next 5 years, genetic screening will become more widely available at the population level, which could facilitate the earlier diagnosis of health conditions, prevent some health-related complications, reduce delay in getting treatments, and help improve outcomes. New to this year's watch list is the addition of 5 cross-cutting issues to watch. In other words, the so what factor. We identified 5 issues that affect the broader scope of precision medicine technologies and their ongoing development, adoption, or implementation in Canada. Issue number 1, the disparities in the implementation of precision medicine technology. In many health systems, there are disparities in who can access and use existing precision medicine technologies, limitations due to cost, availability, geography, and awareness. Further, some populations have historically not been included in health research or the databases used to develop precision medicine technologies. Because of this, the precision medicine tests developed use these databases and are not necessarily applicable to or interpretable for those who are racialized or otherwise underrepresented in health research. Healthcare decision makers will need to ensure equitable development of and access to precision medicine technologies and mitigate the potential for these technologies to replicate or exacerbate existing health inequalities. Issue number 2, increased demands on health system capacity and infrastructure from the use of precision medicine. The emergence of precision medicine will put increased demands on the healthcare system, including physical resources, such as equipment to store and process samples, staff with expertise to perform and analyze tests, and infrastructure, health systems' capacity to maintain databases and provide strong IT support, for example. These increased demands may affect how precision medicine is adopted and implemented across Canada and its long-term sustainability. However, it's also possible that with appropriate use, these technologies will reduce unnecessary care and improve patient outcomes over time, resulting in more efficient and effective healthcare. Issue number 3, evolving roles and scopes of practice for healthcare professionals. Greater adoption of precision medicine technologies into routine clinical practice may lead to evolving roles and scopes of practice for many healthcare professionals. Many healthcare professionals who have not traditionally had direct contact with precision medicine are finding themselves needing to adapt to ordering, interpreting, and/or consulting patients about genetic tests. With a lack of clarity in roles, they report challenges in determining who orders tests and when, who interprets the results, and who helps the patient navigate their treatment journey. Supporting healthcare professionals may lead to establishing new responsibilities, shifting tasks, and restructuring care teams. Issue number 4, complexity in interpreting test results. As just noted, many healthcare professions report having limited awareness and knowledge of how to order and interpret precision medicine test results, which are inherently complex. Further, the clinical significance of precision medicine tests is not always clear and the results are not always actionable, i.e., the results may not provide direct guidance about what type of treatment or therapy the individual should receive. There's also the potential for incidental and secondary findings. In other words, additional tests that may not directly be related to the reasons why someone underwent the test in the first place. This could have a number of implications for patients and family members, increasing anxiety and uncertainty and adding to the complexity of testing. Issue number 5, challenges in regulating and evaluating precision medicine technologies. Precision medicine technologies will likely create challenges for existing regulatory pathways and health technology assessment processes and methods. For example, assessing each new precision medicine test with a traditional health technology assessment may not be feasible, considering the number of tests that are rapidly emerging and the time required for an HTA. Instead, there is a need to adopt new and consistent approaches for evaluating new precision medicine technologies. And further, system fragmentation leads to challenges in regulating and reimbursing precision medicine technologies. For example, some regulatory processes are federal, while others, such as lab-developed diagnostic tests and diagnostic services, have provincial oversight. Similarly, reimbursement is sometimes at the provincial level, but can also be held by regional health authorities or a hospital, depending on the technology and the jurisdiction. So it's clear that regulatory and HTA processes and methods must adapt by finding new ways to address this uncertainty and heterogeneity. So that is the 2023 watch list. Enough for me. I am now delighted to be moving into what I hope will be an engaging discussion with our panelists. And you can submit your questions by clicking on the question icon. So I'm going to scoot over here and ready to start our conversation. So I wanted to start off by asking the panelists, and I think Dr. Banerjee, I'm going to start with you first. What is your reaction to the technologies and issues identified by CADTH?
Thank you for the question, and thank you for involving me in this session today. So in terms of the technologies, I would argue that while this is being produced as a future list of technologies, in many ways, these are technologies that are at the forefront and are being used in many circumstances across the country and across the world. So it's less about it being part of the future, but more as to how do we incorporate them into our care of today. For me, one of the most important parts of this particular watch list was the top issues that were raised, as a number of these issues really address the point on, how are we, particularly in Canada and with our healthcare jurisdictions, both at the federal level and provincial level, how are we going to start to address these issues? And these are the important questions that will really allow us to keep up with global trends in precision medicine.
Great, thank you. I'm going to ask Karen for your input.
Thank you again, and thank you for including me in this exciting review of the watch list. So I would agree completely with Dr. Banerjee. These are technologies that are at the forefront today, and I think one of the things we really have to think about is this field is evolving incredibly rapidly. There are a number of technologies that are really coming down the pipeline rapidly, and they're technologies that are being used in certain research settings but are almost ready to be used into the clinical care settings. So I think, again, to support what Dr. Banerjee said, probably the issue is not really the technologies that have been identified, but really those issues raised, because I think those are going to be the barriers to adoption by the healthcare systems of whatever technology is coming down the pipe.
Thank you. Valerie, I'm going to turn to you from a patient perspective. What's your reaction to the watch list?
Sorry, am I muted? Sorry about that. Okay. I agree completely. I think that the so what part of the list is actually probably the most important. The technologies are really complex and really exciting. And I think from a patient point of view, it's really useful to have CADTH providing this list to help people sort out what is the hype and what is possibly promising for these issues. But the so what part is the most important. And as a member of the advisory committee, I'm really pleased to say that it's a very readable report. And I think that it's very accessible to all kinds of people. And it's a very important document for people to read.
Thank you. Dr. Banerjee, I want to pick up on something you said about the use of these technologies across the world. Are there any jurisdictions that you can speak to that, from your perspective, are really sort of ahead of the curve in adopting these technologies?
Again, from my perspective as a clinician, I see some discrepancies, particularly on the health side, between systems that are perhaps universal healthcare systems versus mostly private or patient pay systems. I think in the latter situation, you definitely have these types of technologies being adopted more readily because, one of the main barriers to access is cost. And in those health systems, the cost is essentially transferred to the patient. In more universal health systems, I think different jurisdictions have various levels of access. But then the whole question of what is the value of any particular test or any particular type of technology, what value does it play in the healthcare system? And I think that within these public payer health systems, we very much get caught up in the value question and never truly follow up on that value and do formal assessments. And ultimately, rather than being a temporary barrier to assess value, it becomes a permanent one because we never actually wind up collecting the data needed to show that these technologies are truly improving standards of care or improving the cost effectiveness of care.
Thank you. Karen, do you have any comment on that?
Well, I think we often also don't look at what's the cost of not adopting these new technologies. I think that's something that it's difficult to assess, but if we don't adopt some of these new technologies into our healthcare system, we fall further and further behind. But I would like to sort of follow on also a little bit about the private payer system versus the universal healthcare system. And I think, even in a universal healthcare system, often these technologies are only used in very specialized tertiary care settings, university hospitals that have the expertise that is there to be able to provide the precision health technologies to the patients. And so that's something that it is really, if it's going to be adopted, it has to be a technology that can be accessible to all and not just provided in very unique health care systems.
Great, thank you for that. Valerie, I'm wondering if I could ask you a question from a patient's perspective around what should health systems be considering to improve the patient's journey as it relates to precision medicine?
I think there's all kinds of things that need to be considered. Part of the problem right now is we have a very fragmented healthcare system. So already some of these tests are available in some jurisdictions and not others. I had an example in my own family where my cousin and my aunt both have breast cancer, and one got a whole array of tests that the other was not entitled to because they live in different provinces. There's also issues around with new kinds of testing. Who's in charge? Who keeps track of what's being tested? Who reports the results? the system's pretty fragmented already when a patient is undergoing complex treatment. And as new tests are developed, then what happens? Who keeps the patient apprised as to not only new tests, but perhaps new targeted therapies that might be available? So it's a question of how does a patient navigate through all of these changes, and what supports are in place to ensure equitable access for all sorts of reasons, whether it's geography, jurisdiction, income, but also just the kinds of systems that are in place to support patients through their diagnosis and treatment.
Thank you. The issue of equity really came out clearly in the report, not only in terms of equity of access, but equity in terms of research. So maybe just talking a little bit about equity. Dr. Banerjee, what do we need to think about now in terms of diversifying and studying genomics from individuals with diverse backgrounds? So how do we improve sort of the research for those underrepresented groups?
I think part of it stems with we have to reduce the barriers for all populations, particularly the underserved populations, to access this type of research. The reality right now, a lot of precision technologies that are out there, patients are accessing them, but that access is entirely determined by the socioeconomic status of those patients. So for, as Ms. McDonald brought up, patients who have the means, there are limited barriers to accessing these precision technologies because individuals can go to other jurisdictions, to other parts of the world and access these precision technologies. But the reality is that the majority of patients don't have those tools. And so as part of research, we have to ensure that there's communication to the larger population of patients to participate in that research, and from public agencies to also provide funding so that research can include these more vulnerable populations as well.
Karen, your comments?
And I think that a lot of these tools are based on information that has been collected from peoples of European ancestry. So even if there's access from diverse groups to the information, it may not be representative of their heritage and genetic background. So I think one of the other things we really need to do is look at ways in which we can actually share data from across the world. And data sharing is one of the, actually wasn't identified as an issue or a barrier, but it is one of the big barriers to precision health across Canada, is the sharing of data across jurisdictions. But we need to find ways to share it not only within Canada, but also within across other countries. So we do have the genomic information that's being used for these tests is representative of many different ethnic groups and populations.
Thank you. We had talked earlier about maybe diving into one or two of the trends, and Dr. Banerjee, we talked about the omics trend, and wondered if you could just maybe delve into that a little bit more from your perspective and the use of that technology.
Well, omics is a big term, but the general idea being conducting some form of assay, for lack of a better term, that gives us broader, more in-depth complementary information to learn more about an individual's health. And we see penetration of this type of technology in all aspects of care. As an oncologist, I consider myself quite fortunate to be at the forefront of the use of a lot of these technologies. It's quite exciting to see how it has transformed cancer care and provided our patients the opportunity to access drugs that we perhaps didn't even think of a decade ago. But along with those opportunities, it's caused significant amounts of challenges. There is significant regional discrepancy in terms of access, and there's significant challenges with the healthcare system to ensure that everyone involved, whether it be the physicians, but sometimes we only focus on physicians and we forget that everyone who's either at the forefront or background of patient care needs to update their skills and needs to be provided with the resources that will allow them to update their skills to keep up with these changing times. And these investments were hard enough to have made prior to the pandemic. And unfortunately, I would argue that with the pandemic, it's become even harder to have the system make these investments because of so many other competing interests that exist.
I'll keep you in the hot seat for a moment still. We have a question from the audience. As we know, the focus of precision medicine is not only on extracting clinical insights from omics/genomics data, we also need to consider other required data such as behavioral, personal, lifestyle, and environment. But it seems that more precision medicine technologies or approaches are focusing on the genomic aspect of precision medicine. Can you explain why that is?
So it's a great question, and I think part of it has to do with personal health information and what types of data as a health system we're allowed to collect readily based on rules that are in place in various jurisdictions. The other aspect is how siloed the data is. I think we all forget how much data we input into our cell phones or other electronic devices on a daily basis that perhaps address some of these personal health pieces, such as our general habits or exposures, etc. But none of that data is easily linkable to the genomics data. And the reality is, outside of our health systems and commercial partners, that genetic information is kept very separate. So there needs to definitely be some changes on the administrative front in terms of how are we going to change policy to allow for more fluid exchange of data, both within local jurisdictions, national jurisdictions, and international jurisdictions. And then how do we move away from siloing data so that we can get a more holistic view of patient health and the omics that might inform that health?
Great, thank you. I'm going to move to Karen, and Karen, just picking up on that whole concept of data sharing, which you already raised, maybe just more broadly, where is Canada in terms of strategies to implement genomic medicine into our provincial and territorial health systems? And then maybe if you could also address data sharing and what would that look like if it was to work?
So I think it's very, that there's not really an easy answer to the question about where is Canada, because I think, as Ms. McDonald and Dr. Banji had mentioned, it does vary where you are in Canada, because a lot of we have our provincial healthcare systems, there's a lot of difference in adoption of genomic medicine across different systems. I think it's certainly genomic medicine and precision health are being used in Canada, but they are being used primarily as coming out of some research work, and often done within the clinical setting of research projects. So where we are compared to other countries, I think we're maybe behind some other countries, particularly countries with other universal healthcare systems like the UK, because in many ways UK does have multiple healthcare systems, but the large one, the NHS England, is really has embraced genomic medicine and has been taking that and using that and trying to implement that. Data sharing is, I mean, it's a huge challenge. There are many initiatives to try and address this, but I think, as Dr. Banerjee said, a lot of the challenges are around the personal data, the data that may be in your health records, and sharing that data, because there are real questions around privacy and what can be shared, what can go across different jurisdictions. But there are a number of initiatives that are underway that are trying to look at that and trying to really help create data in formats that can be shared, that are addressing some of those privacy issues that we all are concerned about.
Thank you. Maybe just taking a bit of a step back, what is the value of this report? And maybe I'll just start, Valerie, with you. From a patient and public perspective, so what's the value of a report like this?
I think we mentioned this earlier, that the real value is in so what part. I think it's outlined some of the really key issues around precision medicine, around the testing, and it highlights some of actual problems within our healthcare system generally. So I think for patients, it's an opportunity to think about new ways of diagnosing conditions, new ways of treating them that are coming forward, and also a way to figure out, well, why isn't it happening? Where are the gaps, and what do we do to address the issues and challenges? So in many ways, it's a great advocacy tool, I think, for the public to ask for better, more coordinated care for all kinds of different conditions. And it also does highlight some of the real problems for rare condition children in particular, who are often underrepresented in these kinds of databases. So I think there's lots of uses for it as a reflective tool in particular.
Maybe Dr. Banerjee, from a clinician, health system leader, or policymaker perspective, what's the value of this report?
As both Dr. Dewar and Ms. McDonald have mentioned, I think the value is having these important conversations documented in one place, providing the rationale and to summarize these points. And the reality is, in Canada, because of our federated health system, we don't have a lot of national voices. For example, on the oncology side, if we want to put national guidelines together, we either work with patient advocacy groups, such as Lung Cancer Canada as being a major one in lung cancer, or groups of physicians that come together on an ad hoc fashion. But other than putting recommendations in place, there really isn't a national entity that then takes those recommendations forward to a next step. And I think that's what we really need to come from a document like this, which is what agency in Canada will take this watch list, take the knowledge of these issues, and then ultimately put together teams that will strategize on how we're going to solve them. Maybe CADTH plays that role, maybe there's another organization, but these are the next steps that are required.
And Karen, same question to you. What is the value of a report like this?
I think Ms. McDonald and Dr. Banerjee have really highlighted some of the key elements. For me, it's also something that the provincial healthcare systems can look at and really think about. What do they need to do? How do they need to evolve to be able to take up and adopt novel technologies for precision health? Because whether they're these ones that are taken up and implemented or they're others, this is the future of healthcare, and it is changing. Healthcare is going to be delivered in different ways from what it has been in the past, and it gives those healthcare systems a heads up about what's coming.
So So I have another question from the floor. Several speakers suggested that current approaches to health technology assessment may not be up to the task of supporting the widespread adoption of precision medicine in publicly funded healthcare systems. What are the contours of a next generation HTA system that would be up to the task of enabling the timely spread and scale of precision medicine in Canada? Don't know who wants to start by tackling that one.
I could say one thing, which is
Absolutely.
for pediatrics, it's a big problem, and we don't know. HTA doesn't work that well for pediatrics, and there is an initiative underway that, as Dr. Banerjee pointed out, is really an initiative of clinicians to bring together pediatric cancer experts to try to come up with a better framework to look at that. So there are initiatives underway, but there is an awareness that it's not working. How we do it requires some more investigation.
Karen, do you want to try to tackle it?
I can't really speak from an HTA assessment point of view, but I think what we really do also need to look at is we have some, gold standards of clinical assessments like randomized control trials. And we have to look at those and see, does that make sense in a precision health environment where you're actually selecting for individuals based on certain genomic markers. So I think we've got to look at all the tools that we have used as standards for making our assessment to ensure that they actually fit the new technologies that are coming online.
Dr. Banerjee?
So I will say, as someone who's tried to do some of these HTA assessments at a local level, is one of the first steps that need to be taken in Canada at various jurisdictional levels is we need to build in that the ability to capture the data that will go into the HTA assessment as part of our standard healthcare operations. That sounds like a simple thing to do, but it's extremely challenging in our healthcare system to do that on a real-time fashion. And so often when we're doing any type of assessment, we're doing it as a retrospective analysis, sometimes a half a decade later, because that's when we feel that there's sufficient accumulation of the data to perform the analysis that we're trying to do. So we need a mechanism to be able to capture that data in real time and have some established baselines against which we can compare that data. The other piece that we have to keep in mind here, and Dr. Dewar alluded to this in her comment, is that to do many of these health technology assessments with existing tools, we use methodology that compares hundreds or thousands of patients in order to find statistically significant results. The reality with precision oncology is that if the tools are actually working properly, it means that we are taking large populations of patients and dividing those patients into smaller and smaller slices of the pie. And that dramatically can impact our traditional statistical tools. And so we need to address how we're going to challenge our norms in terms of our analysis in order to perform these types of evaluations on a real-time basis in a way that gives us meaningful results that will allow the system to change, but also allow our patients access to these technologies without having to wait a decade or two until an assessment is done.
It's a fair comment. I think the other thing I would say, taking off my moderator hat, putting my CADTH hat on, at CADTH we are looking at how to do more fit-for-purpose technology assessments, the use of real-world evidence in doing those assessments, so really trying to think this through, given, to your point, that people can't wait decades, and so how do we make this work moving forward? One of the questions that we had talked about when we had met earlier was this idea of how do we maintain the momentum from a report like this, and how do we push forward on innovation when, as a country, as a world, we are still grappling with the post-pandemic impacts and some of the high priority issues that are facing the systems right now. So how do you sort of balance innovation and pushing forward with the issues of the day? Valerie, do you want to maybe comment on that?
I think that's a really difficult question. People are preoccupied with the issues of the day, but I do think this particular report, because it's so clear and written in plain language, is a really great opportunity. And if it's disseminated properly, is a really good resource for patient groups, for the public, just to understand what some of the issues might be. So to me, that's a first step. You can't really control the issues of the day, as we've seen, but something like this is a very helpful tool.
Dr. Banerjee?
I think we have to keep in mind that in order to innovate and keep up with the innovations, we have to, at a baseline, keep up with investments in the basic infrastructure. And the reality is that basic infrastructure consists of instrumentation and technologies to be able to perform these omics. But I would argue even more importantly, and this is where I believe Canada can really make some important strides, is we need to invest in the people. We need to invest in the people that know how to operate these technologies and understand these technologies. And we need to start making that investment now, along with all the other investments we're making in healthcare, such as hiring more nurses, hiring more other high qualified personnel. Along with kind of our traditional high qualified health personnel, we have to ensure that we have the high qualified omics personnel coming up in parallel so that we are ready to keep up with the pace of innovation.
And just, do we have the training programs for these people, or would those have to be created as well?
I believe we definitely have the training programs when it comes to research frameworks and research methodologies. But I think where training programs need to change a little bit is create more of an overlap between those who are destined to be frontline healthcare providers and improving their knowledge of how to build and apply these types of omics information.
Thank you. Karen, your thoughts on how do we balance innovation with what's currently ahead of us?
I think training is critically important, and training not only of specialists but in these areas, but also training of all healthcare practitioners in the use and understanding of the results and the information that comes from these technologies. And I think investment in one of the areas that was identified was sort of digital. I can't remember exactly what it was called, but your first area of precision health was around the digital tools. Well, I think there can be digital tools that can be developed to help health practitioners understand and interpret information that comes from these precision health technologies as well, so that it's not just down to the genomic specialist that can look at the information and say, come up with the diagnosis, that this could be accessible and available to everybody.
Could I add
go
something?
ahead. Yeah.
Yeah, I
Go
just
ahead.
want to say that I agree with all of those suggestions, and I certainly agree that people are the most important part of this, training people, preparing people. And I think the people that also need to be involved are patients as partners in co-designing some of these new processes, because patients can point out gaps and challenges and also identify the needs that they might have in these processes. And so I think they're a key part of this patient-centered care and co-designing with patients.
It's a great point. Thank you for flagging that. Sort of along the same theme about people, we've had a question from the floor about the impact of precision medicine on healthcare human resources. What does this all mean for the workforce? Karen, any thoughts?
That's a tough one. I mean, I think there's short-term and long-term impacts. It will mean that there will need to be training of both the healthcare providers and also information provided to patients. I think already it's coming. I mean, as was mentioned, that many people have had their genome sequenced through Ancestry DNA and 23andMe, and they get some medical information that then they go to their healthcare provider and ask for, what does this mean? How should I respond to this? And I think it is really important that healthcare providers have an understanding of these new technologies so that they can respond and that they can, as Mr. McDonald said, work carefully with their patients to develop healthcare plans. So there will be retraining, but I think in the long run, it may help the workforce use some of their resources more effectively. If you can have better diagnoses and better treatment plans, then I think there can be a more effective use of the healthcare dollars in terms of those treatments.
Dr. Banerjee, your perspective on health human resources and the impact?
Well, it's definitely going to have an impact on human resources, but I think to put a positive spin on this, I think we have an opportunity now to look far beyond our traditional streams of healthcare personnel. When we think of healthcare individuals, we think of pharmacists and nurses and physicians and unit clerks and et cetera. But to properly implement omics, we're going to have to go far beyond that. We're going to have to include the programmers, the biostatisticians, the bioinformaticians, engineers, process developers. I think that we really need to take advantage of the skill sets that are out there beyond what it has traditionally been part of healthcare systems, and really probe those minds and challenge talent from all levels to come up with solutions that perhaps our traditional healthcare system doesn't quite think of. And as Ms. McDonald pointed out, I think patients are central to that. And we also must not forget the fact that patients aren't just patients. Patients are also professionals, and they bring a lot of professional talents to the table as well. And so we need to leverage those situations. And part of that is removing some of the traditional administrative barriers to ensuring that individuals with vast skill sets are considered as part of the healthcare workforce.
Thank you. It's a great segue into sort of our closing remarks. So, and I'll start with you, Dr. Banerjee. You have the floor. So if you had the ear of anybody about this topic, what would you say?
Well, I would say that, precision medicine and omics is no longer the future we have to prepare for. It's here and now. In some fields more than others. Again, since I have the floor, I will advocate for oncology. If we do not keep up with the investments needed to implement precision oncology, we will fall further and further behind at the regional level, but more importantly at the national level. And the fields are moving so fast that if we're standing still, we're falling behind. And so those investments need to be made, and those investments need to be made in several critical areas, the most being infrastructure and people. And then to facilitate that, we need to ensure that the national administrative policies exist to allow the individuals within that infrastructure to innovate, because that's ultimately the goal of these precision medicine efforts.
Thank you. Karen?
I don't know that I can add too much more to what Dr. Banerjee said. I think that's exactly right. I mean, we have to invest in precision medicine and these technologies, and we already are doing some of this, and we have to invest in the infrastructure and the people, education, and I think that often we think the introduction of new technologies costs money, which it often does at the beginning, but we have to also look at the longer term. What are the really cost savings that can be in place if we are able to introduce these technologies, and what's the cost if we don't?
And Valerie, last word to you on this point.
Well, I agree with everything that's been said, and I think that we have an exciting opportunity to invest in new ways of providing care to people, to diagnosing issues and treating them in a way that may be more effective, more efficient, and have better outcomes. But I think we need to do some strategic thinking and partnering. And I heartily agree that while we do need infrastructure and technical expertise, it's people that really can make a difference in making this new system work a lot better for the outcomes that benefit patients and families.
Thank you. Very well said. Thank you all so much for attending the launch of this year's watch list. I hope you found it informative and hope you're excited about the prospect of precision medicine in Canada. So just in closing, in the chat, you will get a link to our report. We will also be emailing it out to everybody. We will also be emailing out a survey, post-event survey, so kindly fill that out. In terms of our symposium that's coming up, or just a reminder, if you enjoyed today's event and want to delve deeper, consider attending our 2023 CADTH Symposium, where we actually have a session on precision medicine amongst other topics. This year's symposium will be held as a hybrid event, May 16th through to the 18th, with the in-person program taking place in Ottawa, and you can look at our website for more information. And last but not least, this is like the closing credits of the Oscars. Reports such as these and events such as these could not happen without the support and dedication of a large number of people. I'd really, really like to thank the CADTH staff, many of whom are here today in the audience, the main authors of this report, Sinwan Basharat, Andrea Smith, Nazia Darvish, and Tamara Rader. I'd like to thank Kristen Moulton, Chris Camel, and Leslie Dunfield for their leadership. Our comms team here at CADTH today for setting up today's event, Andrea, Carly, Jose, and Chris, and would really like to thank our advisory group and our panelists today, Dr. Banerjee, Valerie McDonald, and Karen Dewar, for an excellent conversation. And lastly, to all of you for attending and engaging today, thank you so much. On our next slide, we have our contact information. So if you'd ever like to engage with us, either via email or on social media, there are the links. As I mentioned, please fill out the post-event survey. We're always looking as to how we can improve, and we appreciate the feedback. Have a great day and a great rest of your week. Thank you so much.